Happy Thursday, everyone. It's Lorelei here. Welcome back to my channel with up-to-date news and resourceful information on mental health. If you are new to my channel and you find the videos helpful, don't forget to hit the like button down below. Let's get started on the news for this week. Trudeau appoints Bennett as Mental Health and Addictions Minister in new cabinet. Prime Minister Justin Trudeau's freshly appointed cabinet includes a new ministerial post to tackle his election promises on mental health and addictions. Carolyn Bennett, who served recently as Minister of Crown Indigenous Relations, has been tapped for the mental health and addictions portfolio. The role is hived off from the rest of the health portfolio, which will be helmed by former Treasury Board President Jean-Yves Duclos. A lot of people, I think, have seen that mental health has become a parallel pandemic and that we actually need to really dive in and make sure there is a mental health strategy across all government departments, but also with the provinces and territories, Bennett said at a news conference Tuesday. The Liberal platform promised a new federal transfer of $4.5 billion over 5 years to provinces and territories to provide accessible, free mental health services. Advocates for mental health, including the Canadian Mental Health Association, applauded the added focus in Cabinet on improving mental health care in Canada. We have a unique opportunity in this moment in time to address long-standing gaps in our mental health system, from the lack of timely access and culturally sensitive care to care gaps in remote locations and patchwork programs. Margaret Eaton, CEO of the Canadian Mental Health Association, wrote in a statement, "Rates of depression and anxiety have increased across the board during the pandemic, according to the Mental Health Commission of Canada, and isolation measures weighed heavily on those who were already living with mental illness or problematic substance use prior to COVID-19. This appointment is a critical step as we work to improve the mental health and substance use health of all people in Canada," said Michelle Rodrigue, President of the Mental Health Commission of Canada. Bennett will also be tasked with development of strategy to end the opioid crisis. In addition, the promises include eyeing other government policies through a mental health lens. Trudeau vowed to review access to the disability tax credit, as well as other federal benefits and programs, to ensure mental health challenges are among the qualifications. He also promised to include mental health as a specific element of occupational health and safety under the Canada Labour Code. New mobile clinic offering mental health addiction services in Peterborough and area. A custom-built, retrofitted bus will be used as a new mobile clinic offering mental health and addiction services in Peterborough and surrounding area, the Ontario government announced today. The mobile clinic is one of 4 announced in the 2021 budget, which will offer a full suite of mental health and addiction services offered by a multidisciplinary team and appropriately trained social workers and/or nurse practitioners. The team will be able to conduct intake and brief services, referrals to existing services, and psychiatric support and follow-up. The Canadian Mental Health Association, or CMHA, of Haliburton, Kawartha, Pine Ridge in Peterborough will be responsible for overseeing the development and operation of the mobile mental health clinic in the city. The CMHA branch serves Peterborough, Peterborough County, the city of Kawartha Lakes, and Haliburton. Ontario Doctors Group shares priorities for healthcare system improvements. Reducing patient wait times, expanding mental health, addiction and home care services, and preparing for the next pandemic should be top priorities for Ontario, says a group representing the province's doctors. The Ontario Medical Association shared its recommendations for improving the province's health system over the next 4 years in a new report published Tuesday. It also highlighted the need to strengthen public health units in light of their important role during the pandemic and to assign a linked team of healthcare providers to every patient. Dr. Adam Kassam, president of the group, said the pandemic has highlighted long-standing gaps in healthcare and changed how it is valued by the general public. I think everyone in society who has been gripped by the pandemic understands the value and the importance of a robust healthcare system, he told a virtual news conference on Tuesday. Canadian entrepreneur gives $5 million to help create psychedelic research center for mental health. Canadian tech entrepreneur and venture capitalist Sanjay Singhal was in his early 30s when he was first diagnosed with bipolar disorder. It had been a lifelong struggle, one moment feeling great, then suddenly mentally paralyzed and unable to get out of bed for 3 days. When I went manic, I would make bad decisions, spend money unreasonably, he said. Up until age 38, my life was a roller coaster. Today, Singhal is 56 and on a mission to transform mental health care. He is the philanthropist behind Canada's first psychedelic psychotherapy research center for mental health at Toronto's University Health Network, or UHN. Starting with a $5 million donation made through the Nikian Foundation that he founded, Singhal hopes researchers at the center can unlock the potential of psychedelic medicine and find answers on how psilocybin and so-called God molecule can help transform mental health care. I was very aware of what mental illness can do, he said in his very first on-air interview about the subject and his personal struggles with it. But Singhal is quick to note that at the Canadian Research Centre, psychedelic medicine will only be used alongside therapy in a controlled setting. I don't want people to do this on their own, he said. I don't want this to become recreational play. The potential of psychedelic therapy goes as far back as the 1950s, when several pioneering psychiatrists experimented with LSD as a possible treatment for mental health disorders. Some of the earliest groundbreaking experiments and research happened in Saskatchewan, but studies into these drugs ended by the 1960s amidst social and political backlash. For scientists, the new research center represents potential for transformational change in mental health therapies and offers new hope for many patients. While much more research is needed, there are suggestions that psychedelics work differently and do not require ongoing use like traditional medications for depression and disorders do. If there is a particular video or a piece of news that has been posted on my channel and you would like to comment on it, I would love to hear from you. I would especially like to hear from you on what your thoughts and views are on the new mental health and addiction ministry that's been set up as of Tuesday by Prime Minister Justin Trudeau. Also, if you know of anyone who is going through a difficult time as in need of any kind of support, I am always here for them. I can be emailed directly at dynamicsandhealing@gmail.com and I will respond within 12 hours. As always, thank you so much for watching this week's news. And until next time, take care. Bye for now.